Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, happy Valentine's Day. It's Lindsay Smith Rogers, and today I speak with Joshua O'Neill, the director of the Southeast STI Prevention Training Center in Atlanta, about his work with sexual health programs and clinics and how to center pleasure in STI prevention and public health. Let's listen. Joshua O'Neill, welcome to the podcast. How are you?
I'm great, thanks. Thank you for having me.
Sure. Today, we are talking about something a little bit different. We're talking about pleasure as STI prevention. But before we get into that, would you give us a little bit of background about you and your work?
Sure, of course. So my name's Joshua. I use he, him pronouns. I oversee sexual health programs. It includes clinics, it includes programming throughout the Southeast. I also am currently the director of the Southeast HIV and STI Prevention Training Center. So I provide technical assistance and training to clinicians and public health staff throughout the Southeast region.
How'd you get into this work?
That's a good question. I think as a young person, growing up in the Midwest, a queer person, in a Christian household, I didn't have a lot of access to information in terms of like sexuality or in terms of sex ed. And so when I got access to that, I think that it changed my life. It changed the trajectory of my career, absolutely. And it was liberating. And so here I am, decades later, still doing the work that I love and showing up hard in spaces like this to keep the message going.
So let's start out. Maybe give us an idea of the types of topics you would normally cover.
Well, that's a great question. So I am here to talk about pleasure, right? Pleasure in prevention and also just pleasure in attaining sexual health. I think one of the things that's missing from the work that we do, the conversations that we have with clients is like the whole reason that we have sex in the first place, most of us in most situations, is pleasure and connection and intimacy. And those terms and those kind of ideals are often missing from the approach that we take as public health. And so my goal is to like reframe how we do this work and how we engage with other clients in order to maximize on our impact, but also influence people and also just give them permission to live their best lives. Because I think in doing so, that's when we actually attain the sexual health outcomes that we're looking for. Some of the examples, how this idea like really came to fruition for me, which is I was working at the STD clinic in Seattle, Washington. And by the way, I just want to have a side note, loaded language is really important in this conversation. And so I'm going to call out when I say things or when things come up that maybe we can shift. So the fact that we've moved from the STD clinic to calling it the sexual health clinic changes everything. The services didn't change, the clinicians didn't change, it's still at the same place, but also the way people feel walking into that space and talking about that with their peers and their lovers, is an entirely different experience. And so that in and of itself is an example of how we can shift our approach to ensure that pleasure and sex positivity is a part of it. When I was working there, I was running a HIV testing comparison study, and I was doing testing on hundreds of individuals over several years. And every time we were waiting for the test to process, we were having conversations about safer sex practices. And this is before PrEP. This is before U equals U. And, condoms were really the thing that we had to rely on the most. And so that was central to the conversations we had. However, I would say 99% of the people who talked about condoms hated them. They talked disparagingly about them. They really talked about how they inhibited their experiences and that they didn't want to use them. And it wasn't a conversation beyond just how do you put on a condom, but the conversations then were like, well, what do you know about them? And beyond how to put them on, people really couldn't say anything. They didn't know anything about brands and materials and sizes and shapes. And we had several at the clinic that I wanted people to try, to take home and try them on their bodies. And so I gave them these little, what I called fit kits that I created. So you could try one on their body, see which ones fit well and feel good while they're masturbating or having sex sex with others. And then they would come back and be like, actually, there's these two brands that I like more than the others. So at least I know I can seek these out and they're available for free. And so I took this framework and went to grad school and used it as my thesis project on how condom impacts sexual pleasure. And I was amazed after doing condom workshops with clients and community, but also with community health workers, the ways in which the relationships change. And what it is it's not telling people you have to wear condoms in order to have safe sex. It really is like, let's have pleasurable, safer sex, and then you'll feel better about your experiences with less anxiety and things attached to those, to those sessions. So that's where I started with the pleasure. And then what pleasure looks like today, when I'm instructing people on like what that looks like, I focus a lot on language. So for example, I want people to be able to use language that is real and accurate. Terms like pleasure and intimacy and agency and comfort and confidence. I want you to normalize that in your conversations. Those are often the things that are not talked about. We focus so much on disease and unplanned pregnancies and disparities, where I think that if we shift the conversation to what we're moving towards instead of focusing on the things we're trying to avoid, we'll get people there more quickly. I like to avoid the term risk, right? Because I think that we, as queer communities, when we're taught that our sex is risky, that we hold on to that and we feel that in our encounters. And I want to just like let go of that. Also, risk is like not specific. It's kind of unfair to talk about people in these overarching terms without being very specific about what the risk is, how transmission happens. And so avoiding that language. I also think about leaning in with curiosity. I think as individuals, regardless of whether we're clinicians or health workers, we tend to stay away from pleasure and desires because we feel bad about it or we're not sure how to talk about it. We're not fluent in language around sex and sexuality. So to like talk about it, first and foremost, will help you feel more comfortable in terms of like the language and modeling what that looks like. And then you're going to hear things that maybe catch you off guard that you're not sure of, like when a client talks about the things that they love and that they're into, and you can kind of like draw back, like, I don't know how to maneuver this conversation, or you can lean in and be like, I'm the one person who has access to this person's information and they're like opening up with me. Like, let's explore that. Like, how did you get into that? And like, how does that serve you? And tell me more about how you negotiate safety in those spaces. And what does pleasure look like in those moments so that you can understand both them and then other clients, that come along. I think that we all think about the things that we hate about our bodies more than the things we love about our bodies. I also think about tools such as U equals U, which is undetectable as untransmittable. People taking HIV meds that cannot transmit HIV, or people on HIV PrEP, or people on DoxyPep, or contraception. These tools will revolutionize people's sexuality. And so to be able to ask them, now that you've on PrEP or now that you have contraception, how has that changed your dynamics? Like your comfort? How do you feel when you come in and do screenings with your providers? I also think of the space in general. So just creating a safe, open space for discussion, addressing gender norms like power dynamics, cultural context is so important. Body positivity, just normalizing the conversations about desires, as long as it's not harming you or other people, it's not getting in the way of your day-to-day function. And then get into it, explore it. I think that there's a lot of ways in which you can move into a pleasure-centered kind of space.
How would you respond to someone who might be concerned that the focus on pleasure would detract from the importance of HIV and STI prevention?
Interesting. I guess my response would be, a pleasure-centered approach doesn't detract from the STI prevention. In my opinion, it strengthens it. I feel like pleasure is often an effective kind of entry point for building trust and rapport and relevance. And when clients feel seen as whole beings, including their sexuality, rather than just like the risk, the more curious and honest and engaged they are in conversations, in my experience, at least in regards to sexual health. I think in my own practice as well, like it's about spending time on what matters the most to the client, letting them take the lead. So like even within quick encounters, I try to normalize pleasure by at least naming it, making it a habit of including it in my dynamics or conversations. It's like kind of like planting a seed that I nurture over time. And I think that people will become more and more open and excited to share experiences when they kind of know you and they know that you're going to hold that space and explore these things with them that maybe they don't get elsewhere. The pleasure certainly doesn't have to be the central topic to the conversations, but it's relevant to like a lot of health topics actually. So I think of drugs, I think of diet and what we eat, I think of activities and, exercise and what drives us, what feels good. And I mean, I guess it's a motivator factor in all of these contexts. So focusing on what to avoid, I feel like shuts people down and maybe alienates them. It might perpetuate the stigma that they experience. Whereas like integrating pleasure moves us toward what people actually want, like these, say, satisfying, connected dynamics. So when we as providers acknowledge that, we become more real, I think, and more effective. And in these moments, in these conversations, I think topics like condoms and PrEP and testing and prevention strategies become easier and more impactful and more normalized.
Some might frame, you're a language person, this is why I'm asking this. Some might frame what you do as harm reduction, but you don't like the word risk. How would you frame what you do?
I mean, it's sexual health promotion, first and foremost, and sex positivity. I do think that harm reduction is a great concept, and I think it is really rooted in drug user health and the history of how we needed to survive epidemics like AIDS. And I think we're in a different place now, and so we can shift how we think about it in terms of like health promotion, which sounds different. Like, for example, messages, visibility. I started a workshop for my staff at the public health department here in Atlanta when I was overseeing the HIV, sexual health, and drug user health program, because many of them never had good sex ed. And how do you be a good sex educator if you never had good sex ed? I teach sexuality studies, and I took my lectures to my staff so that they could like participate in healthy relationships and communication, sexual functioning, sexual difficulty. And I called it the Sexpert workshops, right? The Sexpert series. And then once you graduated, you could have a Ask a Sexpert t-shirt, which was our uniform. And I will tell you this, when you show up in a place with a public health uniform shirt on, people are going to avoid you. You have a table set up. You're trying to give away things so that they can come and like to your table and engage with you. But if you have an Ask a Sexpert shirt on, they're going to come and ask you all the questions, right? They're going to be so excited about it. So I think if we like promote the positivity of it and avoid, again, the harms and the disparities, then you're speaking a language that people are going to understand.
Last question for you. People may not have a Joshua in their lives, or they may not see someone wearing an Ask a Sexpert t-shirt. Where can people go for good information?
Wow, that's a great question. I think asking the questions to the right people who you trust is a way of collecting micro ideas in terms of little things that work for them in their roles. So first is just start by having the conversations and asking the questions. Back to the curiosity, whether it's clients or peers or friends, even lovers, is just start collecting that information. And I also think that, of course, there's some websites and AI in terms of entering in. There's some really amazing publications, especially in relation to pleasure.
How should we be prioritizing sexual health as part of our overall health?
It's a different direction, a different roadmap for everybody. I think it's about the resources, having the tools to be able to then live your best lives. I want to recognize it's really important to think pleasure is liberatory. It is such a special space to be, and it's what we're aiming towards, but it's not always safe or empowering for everybody. It doesn't always feel good for people. So I just want to be careful when we're treating pleasure as something that everyone must attain. But I also recognize because pleasure is so absent in the work that we do, when you focus only on the things you're trying to avoid, that's your entire attention. That is what takes up your mind and your heart space. Whereas I think that when you shift your focus, which is hard to do because everything around you is bringing you back to what it is that is the risk and the disparity and the thing that we're combating. And that's important to know about, as well as how do we use those as motivators to actually get to where we want to go. For example, PrEP promotion that is the most impactful is talking about pleasure because people want to get on PrEP to avoid HIV. Same with DoxyPep. And so when they have access to these tools, it allows them to get rid of that fear and then center pleasure as something that they're trying to attain. And so it's a mix of the tools and the language and the access that I think all together, when we collaborate, we can achieve.
Any last thoughts for us?
Yeah, I just want people to know that pleasure is a powerful public health asset, that it is a legitimate health outcome, and it is something that not only deserves focus, it deserves attention and centering in your spaces. And please lean into it with curiosity. Get into it, as I like to say.
Joshua O'Neil, thank you so much for joining us.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter. with support from JB Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.